Welcome to my good friend, Professor Chuan-Gang Fu. Professor Fu is the chair of colorectal surgery at Shanghai East Hospital, professor of surgery at Tongi University in Shanghai. He is also the president of the Chinese Society of Anorectal Surgeons and an honorary fellow of the American Society of Colorectal Surgeons. Welcome, Professor Fu.
Hello, Professor Wexner.
Thanks for joining us today on From the Front Lines, today being June 10th, 2020. I'd like to start with a question to you, asking you what was done at your hospital and in Shanghai in general to try to prevent a similar explosion, essentially, as to what happened in Wuhan.
Yeah, it's a really hard time during the late January, February, and March. And that time is the hospital, we take a lot of measures just to make the quarantine is, because in the city is the quarantine, all the staff was in the hospital to prepare for the patient, and the hospital have a special session for the fever patients, and to have the routine examination of the virus and the antibody, so to prevent the virus have erupt in the hospital. Yeah.
What happened after? I mean, at what point did you say things are safe, we can start resuming elective surgery?
At that time is during the onset of the virus. At that time, that is from the February, March, and April, the elective surgery is decreased sharply, and both the hospital and the surgeons very limited to the operation. But from the May, we gradually recover of the numbers and the type of operations.
So you're now performing elective surgery. Can you estimate the number or percent of cases that were postponed or delayed due to COVID-19?
It depends of the hospitals. It's like my department, because it's a center, and so a lot of patients come to my department. So from the May, is the number of the patients recovered about 80%, but now it's about 100% of the, just like before the virus onset. But for some smaller hospital, it's a big problem. Not many operations recovered. Some may be 50, 60, something like that. And we at the very beginning, we thought there may be a surge of many accumulated patient to come to the hospital. But actually, there's not such kind of phenomenon. It's that we thought it may be, is still people still worried about the virus. So if they do not want to go to the hospital. They still think the hospital is a place of a risk for the infection of the virus. So not as expected, is a big surge of patients come to rush to the hospital. No.
That's an interesting phenomenon, which is being reported in the United States as well, that people are not rushing to the hospital. What are some of the steps that you're doing at your hospital to make patients feel safe? Things like testing virus with PCR, testing antibodies for patients and staff, visitors.
Yeah.
What are some of the steps?
It's at the gate of the hospital and the gate of the department. We have some staff there to have the temperature. Any visitor, any person get into the hospital, you have to test for the temperature. And if you to have the endoscope, gastroscope, colonoscope, or you are admitted to the hospital, then both the patient and the relative have to have the virus and antibody tested.
So even the visitors would get tested?
Yeah, should. Because China, I think it's a different tradition. So in China, one patient admitted to the hospital, especially if the patient will have the operation, many of their relatives and friends will come to the hospital and to say hello or accompany the patient for the night, something like that. So this might be a source of virus. So all the patient and the relatives, they have to have the test, and then they could be allowed to get into the world.
Has there been any change in the number of visitors allowed per patient?
Yes. Before the virus, before that, the friends, relatives, they come to the hospital, they are free. One patient could have 5, 6 friends or relatives to come to the hospital to see them. But due to this, during this special period, one patient only could have one relative to accompany them. And the one should have both the virus and the antibody be tested to make sure there's no infection.
Has there been a second wave or second surge of COVID-19 infection in Shanghai?
We worried about that. I think we worried about the risk for the second surge, but until now it's quite safe. So that's what I think is the policy to control of the airplane, international airplane to arrive Shanghai. That's to prevent the import virus. The domestically now is no big problem. Yeah, it's a normal life and normal hospital activities, but we still worried about the risk.
That brings up another question, which is travel. So you mentioned international travel. What is the current status for people being able to travel internationally and domestic?
Now, internationally now is almost impossible because the international airline, almost quite majority of the international airline is closed already. So you could not buy the ticket to go outside of China. But domestically is no limitation now. All the limitations have been limited. So you could go domestically to other cities. But before you get boarding, you have to have your identification and to make sure we have the WeChat. By the WeChat, you make sure of the itinerary, the travel history. So if you have a green color, then it's okay. That means you didn't go to some high risk area, so it's okay.
What would a high risk area be considered? Could you give an example?
In China now, is no risk areas now, but 2 weeks ago is the northeast, one part of northeast China, close to the Russia. There is an epidemic eruption over there. So it's at that time it's about 1 month, and then now that area also become normal. So now it's no such kind of place in China now. But somebody from the other part of the countries, import from other countries, come to China. They have to be isolated for 2 weeks, and to be sure no virus, no antibody positive.
Okay, so 2-week quarantine period if somebody were to manage to come to China from another country, for example.
Yeah.
What about testing for, not in the hospital, you spoke about testing in the hospital, or incidentally, are the staff tested? I mean, do you and the other surgeons and the nurses get tested?
Yeah.
PCR or antibodies or both?
No, antibody, yeah. To make sure all the staff in the hospital, you are free of the virus, you are not positive.
So is there a difference in the assignment of what you do if you have antibody positive or antibody negative?
If you are positive, then you have to test the virus. And once you are the positive of the virus, then all the staff in your department will be quarantined. So that's the policy. So we dare not to be positive of the virus. When anyone, if in your department or in the hospital, if several in the hospital, then the hospital should be closed. That's the policy of China. Yeah.
And if you test negative, there's no virus testing if you're antibody negative?
Yeah. Now this present policy. But it's about 2 months ago, you have to test the virus, not the antibody.
Okay. How often are the staff tested?
But actually now is everything become to normal. So now we do not for the staff in the hospital, surgeons, the doctors, nurses, all the staff in the hospital, we do not test. But people come to the hospital, including the people from the other part of China, come to Shanghai to find the work or to return to their work. They have to test of the antibody. And if the antibody is positive, then they have to test of the virus.
So antibody testing is always done first.
It's quick. It's only 2 hours, but the virus, it takes 6 hours. And also, antibody is more accurate, and the virus, some ways pseudo-negative. So it's a problem with that. So they have to test the antibody first, yeah.
How about public testing? Not hospital employees, not patients, but somebody who's working in a restaurant or shop, cinema. Can they get tested if they want to, if they have no symptoms?
Yeah, for sure. Then anybody, if you want to test, then you have come to just go to the hospital and apply. And then it's about $30 US. Then you could have it tested, both the antibody and the virus.
It's interesting that you did not notice a surge of patients after the January, February pandemic.
No.
Did you notice any change in the stages of the cancer patients? Because one fear we had is potentially more advanced cancers.
Yes, exactly. You know, we have about 5 months backlog. So now the patient came to the hospital. We find a big percentage, much higher percentage of the locally advanced case. It's before the virus, not so many locally and systemic advanced cases, but now quite many. That's the problem. I think it's just postponed of the diagnosis.
Thanks. And one last question, just to put in context what you've been saying. Could you tell us a little bit about the size of your hospital and how many cancer patients you typically treat, colorectal cancer patients?
Okay. You know, the size of my hospital is we have 2,100 beds for all the hospital. And my colorectal department, we have 120 beds. And every year is about 800 to 900 colorectal cancer operations in my department. And 90% of the cases was done by 3D laparoscopy.
Well, thank you for those insights and for putting in context the magnitude of the department which you run and the size of your hospital, as well as how you've been dealing with COVID-19. It's great to be able to speak with you today by video. I look forward to doing so in person, seemingly not this year, hopefully next year, both in China and in the US. Thank you again, Dr.
You know, in China now, we are expecting maybe in November, everything could go to normal and the conference could reopen. So you could come to Shanghai.
Well, I certainly hope so. And I wish you sustained health and best to your family. Thank you.
Yeah. Stay in good health. Yeah. Okay. Thank you.